Welcome to Coffee with Dr. Stewart. This show will provide our listeners up-to-date medical information from a leading neurologist and neuro-immune specialist. Your host is Courtney Stewart, and your medical expert is Dr. Kendall Stewart. So grab your favorite beverage or cup of coffee, and let's have Coffee with Dr. Stewart.
Hello, everybody, and welcome back to another episode of Coffee with Dr. Stewart. I'm your host, Courtney Stewart, and today we're going to be bringing you an episode on therapeutic plasma exchange, or as we like to call it, for the ease of it, TPE. But first, I gotta ask, Dr. Stewart,
Yes.
Dad, how are you doing today?
I'm doing great.
Alrighty, are you ready to jump into this new topic?
Oh, yeah.
Alrighty.
Something that really excites me.
That's awesome.
Yeah, I really get fired up.
So, therapeutic plasma exchange, that doesn't usually catch anybody's ear because I'm like, me personally, I'm like, what even is that?
Yeah.
So, can you go into what even is that?
Yeah, so it's actually something that's been around for a long time. There's just been very specific indications for it. In fact, it's probably been around for about 30 years.
Wow.
And basically what we used to do is start two big IVs, take the blood out of one arm, put it into a machine. And when you actually put blood in a centrifuge, and they do this at every lab in the country, and you spin it down, it will separate into three layers. So you'll have the red blood cells at the bottom, then you'll have the buffy coat, which is the middle layer, and it looks kind of frosty, I guess is a good way to put it. And that has some stem cells, some platelets, some white blood cells in it. And then you have the plasma, which is typically this golden stuff that forms at the top. And that's called plasma. So in that plasma, we have the antibodies that we make. We have cytokines or chemical messengers. In theory, you have toxins and all kinds of other things there. And so what we would do is spin the blood and then pull off the plasma and put new plasma in. Okay? And so therefore it is plasma exchange. You're actually wasting the plasma that has the bad things in it. And then you're putting new plasma back in with your own blood.
Okay.
And then putting it back into the body. Now, there were some problems with it because we basically had to do two big IVs, one in each arm. And some people would have very low blood pressure and you couldn't take it out too fast. So there was some complexity to it, but it's been mainly used in an ICU setting or in a hospital setting for many, many years. And then kind of started to be used for certain things, blood disorders, things like sickle cell, what we call blood dyscrasias, where you would make abnormal antibodies or abnormal cells. We could remove the abnormal things from the blood. And so there's been some very specific indications, but something kind of happened pretty interesting about 20 years ago. Okay. And that interesting thing was called parabiosis.
Okay.
Do you know what that is?
No clue.
So parabiosis is actually sewing two animals together, as gross as that sounds. And so what happened is some people got the idea is they were going to take an old mouse and sew it to a new mouse. And lo and behold, the old mouse actually got healthier and the young mouse got older.
Weird.
Now, in a lot of those mice, they actually reacted to each other because they were different genetically, and so they died. But these ones that didn't and were fairly compatible, that happened, and so that got them very interesting. So what they then did was took the blood systems, okay, and they sewed them together between an old mouse and a young mouse, and the same thing happened. The young mouse aged quickly. The older mouse put on better muscle mass, got better cognitively, and it was kind of a weird deal, but that gave them some ideas that what really is going on? How is this happening? What is being carried in the circulatory system that is actually making this old mouse younger? And so what they learned was, and there was all kinds of theories about what was really going on, but what they think is probably happening is that there was some advantages to young plasma, to the younger blood in the younger mouse that was conferred to the older mouse. And then some people believe that epigenetically we were able to turn on some things and change the cellular structure by something that was found in the young mouse's blood. Now, I feel bad for them going through that experiment. And so after that, they then started wondering if we could actually do therapeutic plasma exchange and actually improve health. And so they started doing some studies. Now, the biggest interest actually, because there are certain neurological diseases that are very benefited by therapeutic plasma exchange. One of those is actually Guillain-Barré syndrome, where you start to become paralyzed in your lower extremities. And they know that washing the blood, even though they can't find the antibody that they assume is causing it, they wash the blood and those people recover faster.
Wow.
We also know in certain chronic pain situations, especially for younger people, if we wash their blood, we actually recover those patients much quicker.
Yeah.
Okay. And so there's been some indications. Well, finally, the company that actually makes a lot of this plasma that we put back in, it's called Grifols, and that's the highest quality plasma in the world. They actually sponsored a study called the AMBAR study, and it was based on Alzheimer's.
Okay.
So there's really nothing you can do for Alzheimer's. Just about anything that we've ever done for Alzheimer's may make things slightly better. Yeah. And so what they did in this study is they took people with mild to moderate Alzheimer's. It was done on 486 people, and it was done in multiple institutions. And they washed them once a week for 6 weeks. Okay, and we'll talk about why they did that. Yeah. But what they found out after following for a year is that the people who had mild Alzheimer's after a year's time were 30% better than they were when they started.
Wow.
Okay.
Awesome, yeah.
The people with moderate Alzheimer's did still decline, but they declined 70% less than the people who didn't get washed. So they had a control group and then they had the wash group. Now they washed them full, what we call a full wash, 6 times, and then there was some very minor washes that they did on those patients once a month. But that really piqued our interest in how in the world is this happening? Because, I mean, obviously, from my standpoint, I like to have some type of objective scientific marker, but you would be shocked at how many new antibodies we're finding that are affecting the nervous system. There was probably, I don't know, 10 to 15 of them back in about 2010. Now today there's at least 50 plus.
Yeah.
So finding those antibodies, understanding what we're doing, we're trying to get a handle on it. Now, what really happened in my practice is I had some very unusual patients start showing up about 3 years ago. A lot of these were people who were fairly healthy, then caught COVID, and then became unhealthy in their nervous system. Yeah. Now, some of them were psychiatric, some of them were cognitive, some of them were immune-based. And so to make a very long story short, we had these neurologic antibodies, and we had 3 major centers who were studying this. We had the Mayo Clinic, we had Johns Hopkins, and we had the University of Oklahoma. And they didn't get along. They didn't agree. And the problem was that that really hurt them more than anything. They were expensive tests. They didn't cooperate. They were very critical of each other. Well, a different company called Vibrant America wound up basically taking all those antibodies, putting them in a single test, and making it available to us. And we wound up taking these people who didn't respond right and checking them, and wound up finding that a lot of them had created antibodies towards certain parts of their nervous system or neurotransmitter receptors, et cetera. So, for instance, I had several young men who basically caught COVID and then developed severe mania.
Wow.
Severe. Like, even to the point where we would give them strong antipsychotics and it really wouldn't help them too much, which didn't really make sense. And because usually when you give them an antipsychotic, especially a stronger one, you'll sedate them so hard that that they really are not functioning, but they're not manic anymore. And we're not talking manic just being hyper. We're talking manic, like doing things, staying up 3 or 4 or 5 days in a row, getting arrested, doing things that are not quite right.
Out of character,
so it didn't feel right. Something didn't feel right. And we wound up finding out that 3 of these young men had autoantibodies to the dopamine receptor 1. Okay. And that dopamine receptor is kind of notorious for causing psychiatric disease. So I wound up sending them to some other facilities to do plasmapheresis, and it wound up improving them. Even though these were brain disorders, when we wash the blood, we do know that after about 2 or 3 months after we wash the blood effectively, we essentially will have the antibodies reduce in the spinal fluid. Yeah. And so these young men returned to normal. Now, some of them are still struggling. We have known for a long time that tic disorder, if you have Tourette syndrome and we wash you, you will get a lot better.
Yeah. Do you want to actually share
one of your I'll tell you the one I'm really frustrated with. So I had a young man who, he will have a tic every 30 seconds, and he just cannot function. Yeah. Well, I sent him to Southwestern University, the medical school, to get washed. Got washed, and by the end of his washes, it was amazing. He had hardly any tics, and 2 months later, really didn't have hardly any tics at all. Yeah. The problem is once you wash out the antibodies that are driving the tics, you've got to control the immune system so that you're not producing more antibodies. Well, this was a 21-year-old young man, and I don't think I have to tell you they're not the most compliant people in the world. And so this young man did not take his medications and did not take the recommendations we made to control his immune process. And sure enough, right at about 10 months after that, started ticking again, and then it exploded into very aggressive tics. So I'm in the process of sending him back to get washed again. Now, the biggest problem we have in a lot of this is they're just looking at in studies of washing. They're not looking at controlling the immune system at the same time. And so I became a little frustrated because in my practice, I sent at least 80 people for plasmapheresis to 2 different areas to get washed. And most of them did get better. Now, I was responsible for controlling their immune system. But if you don't really keep working on your health and keep working on controlling the immune system, those things will tend to come back. Yeah. And so I got a little bit frustrated because there's some politics involved that I won't talk about too much. But I decided to do it myself. Yeah. And so we do have a new plasma exchange machine. It's a very interesting machine. Hopefully we can get you a picture on this episode of me doing it. But the newer machines are very, very interesting in the fact that we only have to start one IV. Wow, yeah. So the biggest problem, there's 3 issues with therapeutic plasma exchange. Number 1 is we have to put a very big IV in you. Yeah. Because we have to take enough blood. So you've got to have good enough veins for us to access it. Now, this machine only takes out 110 to 160 cc's at a time, which is not very much. Okay. And we essentially drain off 50 cc's and put back 50 cc's. So we do not change the blood volume. Okay. The second issue, though, but we've got to do it fast enough where we're not sitting there forever, because once we hook you up, you can't just unhook and go pee. Yeah. Okay, so that's the second issue. You got to have a bladder that can tolerate a couple hour procedure. The third issue is that we've got to keep the blood from clotting in the machine. And so we've solved that, or they've solved that. I'm not going to act like it was me, but by using citrate. Citrate is a natural calcium binding agent, and almost all of our clotting has to do with calcium. So we drip citrate into the blood that we pull out of you, and that can actually, and then we put it back into you. And so we have to make sure that you keep up with your calcium load. Yeah. Because if we do it too fast or don't keep up with your calcium load, you can get signs of low calcium, which tend to be tingling in your fingers, funny sensations around your mouth. And it can even get bad enough where you get into spasms. But so we have to keep up with that, and that's the second issue. And then the third issue really is just understanding how it works and making sure that we only need to do it as much as we need to. Yeah. Okay.
Yeah, because the standard is usually 5 washes.
The standard is 5 washes. So what we essentially tell people is that we can wash out about 60% of your plasma in one wash. Okay. So that would leave 40% in you. So the mathematic model tells us that 60% the first wash, we would skip a day if you were from out of town. We'd then do a second wash, and that would wash out 60% of the 40%.
Okay.
So that's another 24%. Then we would have 16 left. Then we do a third day, and we want out 60% of the 16.
Okay.
You see what I'm saying? And so the mathematical model tells us that after 5 washes, you would essentially have greater than 95% washed out of your body. Now, the problem with that in my mind is that that is only necessary for life-threatening diseases.
Which would be?
Well, if you're going paralyzed and all that type of things, if you really have life-threatening issues, we need
ALS, correct?
Well, ALS is that's a big discussion. Yeah. There has been some papers showing that we can slow ALS with therapeutic plasma exchange. Okay. And those papers came out in 2022. It is still not a standard of care, so we have to be very cautious in how we talk about it. But in non-life-threatening situations, like for health reasons or for things that are more, we just need to get rid of the majority of them. So if I can do 2 washes and remove 84%, the biggest problem is that every wash costs money. Yeah. And so if you don't have insurance pay for it, they tend to run somewhere between $5,000 and $10,000 a wash. And so when you're washing 5 or 6 times, you're talking about $25,000 to $30,000 versus 2 times, which will get rid of 84% in theory of your what you're trying to get rid of and replace 84% of your plasma. A $10,000 bill is a whole lot better than a $25,000 to $30,000 bill. So there's a lot of people doing it for health reasons, for longevity, for other things. You do not need 5 washes for that. Yeah. Okay. But in life-threatening situations, if you can get insurance to pay for it, by all means do it. And I'm certainly glad to send my patients to somewhere who takes insurance for that. We do not. But what we're trying to do is to understand how we can benefit all people's health, especially in autoimmune disease. If you have an autoimmune disease, and I'm not talking nervous system, but truly autoimmune, we do know the nervous system gets affected in lupus and rheumatoid and everything else, and even in thyroid disease if it gets carried away. Yeah. So washing out those antibodies makes perfect sense, but that's not something that's standard of care. So for me, it's something that we need to start doing because the risk of doing it is minimal. There's really hardly any morbidity to it. And it does make common sense to get rid of the offending problem. Now, ideally, I like to think that, a drug company, well, their idea is to treat the symptom and calm the inflammation and not get rid of the problem as much as they'd like to. So there's a little bit of pushback in Western medicine, but I do think it's an excellent idea for certain people. Yeah.
Yeah. I know in the last episode you mentioned a little bit about it in treating long COVID. So is somebody with long COVID wanting to do TPE, or do you think that would help? How does that help them?
Yeah. So if you have spike proteins in high quantity still left in your body, those spike proteins are in the plasma. They're stuck in the ACE receptors, and then they're in the plasma. So we literally have some labs that can actually measure the spike protein. And if we see it's very large, I like to be able to measure something so that if I do say, hey, this thing costs $5,000, let's wash your blood, I want to remeasure it to see that it worked. And so in general, once we wash that spike protein out, we've reduced the antigen. So the antigen is something that the immune system's responding to. So an antigen in an allergy shot is everything you're allergic to. Okay. So the antigen, by reducing that, we keep the immune system from reacting so hard. And in theory and in practicality too, we reduce the inflammation in the body.
Yeah. I have 2 questions for you. What is the test that you use to test all the different antibodies called?
So there are various tests that check antibodies for various diseases. So we have a lupus panel, we have a rheumatoid panel that can come from your standard lab. Okay. We also have some sophisticated non-standard lab tests that we can send off. I tend to use Vibrant America, and they can tell us about other antibodies that we find.
Yeah.
But like I said, me being scientifically based, I love to have some type of marker. Now, there are lots of disagreements over this with doctors. They don't trust certain labs, but these are CLIA-approved labs. These are labs that basically the government oversees to make sure that they're giving us the right answers.
Yeah.
And I mean, you're going to you get 20 doctors, you get 20 different opinions. But in general, it makes perfect sense to me that if we have an abnormally elevated level of an offending antigen or antibody, why not wash it out?
Yeah. Yeah. Okay. And then my second question is, you mentioned putting new plasma back into the body, and so is that plasma from other people? Is it synthetic? Like what? How do they get
I wish
that?
it was synthetic. It's not.
Okay.
So we take other people's plasma, we microfilter it, we refine it, we do all kinds of things. We then irradiate it.
Okay.
And it basically turns out as just albumin. So there's no antibodies. So albumin is a protein. It's a 5% albumin solution. And so they've taken out everything else in it. But the FDA right now requires that we put in albumin from other human sources.
Okay. And so it's usually from people that donated it, or
people that donated blood, and they process it. Now we irradiate it. We do everything we can to make it as clean as possible.
Okay.
We only use the best for our clinic. There are different sources for it. We only use the most well-known of those plasmas. Now, I hope that in some way in the future we'll be approved to use some synthetic things, because other people's blood products doesn't make a lot of people comfortable.
Yeah.
Makes me a little uncomfortable. But I do know that I'm not uncomfortable enough to not do it.
Yeah.
For myself, and I would never do anything for my patients that I'm not willing to do for myself. You know that about me.
Yes.
And so I will tell you that I do trust this Griffold's product, and it is checked for spike and all the other things to make sure we're not giving something back to you. And it does not have any cells in it, so we're not transferring DNA or RNA or any of that other stuff with it.
That's awesome.
Okay.
Would you want to share any patient success stories that you feel like they did it and then they're still doing wonderful by doing the protocol afterwards?
So the most successful patients tend to be things that I'm so neuro-based in my situation. Besides the three young men I told you about, there's one of those three who didn't quite follow his protocol and has tried to come back, but has not come back near as severe as it was before. Now, he may need to be washed another time. All of the people I sent to these other facilities did get washed 5 times. I really feel like in non-life-threatening, and I don't want to offend them, I'm not saying they did anything wrong. But what I will tell you is I do not think that we need to do that.
Okay.
Now, once you wash a person, there are many ways to go about calming the immune system. There are medications we can do it with. There are peptides we can do it with. Thymosin alpha-1's been wonderful. There are actually exosomes, which are from amniotic fluid that work great for calming inflammation and antibody production for a good 6 to 9 months, and we can use that too. But the important part is that once you wash them, that we get the inflammation all calmed down and we keep them from making the antibodies that will return. So I would tell you that the people who have Guillain-Barré with foot drop and other things, they responded very well when we washed them. The people who had autoimmune disease of other types, so we had some people who we sent to get plasmapheresis, and they essentially got washed. Now, the interesting thing about it, I had to send them out of town. So these people did not live in Dallas or Nashville where I sent them. And so when you come from out of town, they will actually wash you, skip a day, then wash you. And after the second or third wash, those people feel fine because I would talk to them. Once you do 5 or 6 washes, though, it's like getting hit over the head with this hammer. And so in general, I think that in non-life-threatening situations, I like to wash and then go back a week or two later and I'm also preparing the patient. So what was really interesting, the people we sent them to, they really knew that our patients did exceptionally well.
Yeah.
And what I don't think they would mention it to me, and I'd talk to their medical directors. And I think they really weren't thinking about preparing the patient for the wash. So if you came in and said, I want to be washed tomorrow, I'd probably tell you no. Even though I could do it, I'd probably say, why don't we take 2 or 3 weeks and get you prepared for this, because this is a much bigger deal than you think. So getting your nutrition right and getting all those things right. So my patients, once they get washed, if we do 2 to 3 at a time, and they tend to feel great. I add a little steroid at the end because we're also pulling out your hormones and your steroids and everything else. So in general, if you pay attention and you do it effectively and you get them on a good nutritional source and you really have them taking their supplements, because you're going to wash out all their supplements and all their medicines, we basically have people who recover, and I would say it's probably 70 to 80% effective. Yeah. Now, there are a few people that get washed and don't feel any better, and I think it's probably because either we take too much out of them or we didn't quite get the diagnosis right. Yeah. So it's not a guarantee, and that's why I like to have something objective to measure. Yes. We will not have that in a lot of situations. And in fact, in most of the standardized, well, I won't say most, let's say at least half of the ones that are approved by insurance, there's no, like ticks, you don't know the antibody that's causing that. No. We suspect some things, but we don't have them. We certainly don't measure them. Yeah. And so let me give you a patient who essentially had horrible brain fog, cognitive problems, had horrible rheumatoid arthritis, had a rheumatoid factor that was really high. Yeah. We were able to send them for plasmapheresis, came back, their rheumatoid factor had dropped almost 90%. Wow. So, and we didn't stop the arthritis, but all of a sudden the joint inflammation and pain got much better. Yeah. The brain fog tended to go away over the next couple of months. Now we were still working on the immune system and keeping it calm. And so what it does, and where it's really useful for me, is there's no sense in going straight to plasmapheresis or therapeutic plasma exchange. But what you want to do is medically help these people. And if they don't respond to the medical assistance, I think it's a great tool to have in your arsenal to go in and go ahead and take the antibodies out. So I don't necessarily think it's a absolute first line therapy, but for my patients, you know, I see people that have seen 10 and 15 doctors before they get here. There's some really bad cases. Yeah, I mean, really bad. And so I think it's a great opportunity for us to have another tool in our arsenal. I think from a longevity standpoint, these studies are showing us that not only removing whatever we're removing with the plasmapheresis, but the strength of albumin being a phenomenal antioxidant, I think is going to play a big role. Yeah. If it's affordable for you in longevity and health. And in fact, there are some people that are recommending yearly plasma exchanges. And I certainly would be willing to do that. I'll probably do it myself. And then we'll just learn, because autoimmune disease of any type is a nightmare for patients. It's just not fun. And it really is not just the autoimmune disease we see. It really affects the whole body. Yeah. Just makes you feel terrible. So getting rid of the offending antigen or antibody just makes sense. Now, there's some people that tell you that you pull toxins and stuff too. Well, you do some. But always remember, we've got to take something to bind the toxin so it will be in the blood when we take it out. So we do use some type of natural binding agents to get toxins, because if we're going to wash, we want to get everything out we can. Yes. Okay. Yes. And there's really not a lot of contraindications to it, except we don't tend to do kids. If you're less than 18, I won't do it in the office. That needs to be done in a hospital setting by pediatric specialists. But for the most part, as long as we can get access, and some people just don't have good veins and we can't. And
so in that case, then would you send them to a hospital to
I tend to send them
or something? Or?
As a port, yeah. Okay. And that needs to be done in a hospital.
Yeah. When it comes to preparing to get plasmapheresis, your whole goal then is to control inflammation. Is that like the big thing prior to
inflammation control, making sure that we overcome your vitamin deficiencies because we're getting ready to wash out everything.
Yeah.
We'll ask you to stop your vitamins the morning of.
Okay.
But we'll start them back.
You start it right back.
Right back because you're washing out everything.
Yeah.
And so, like if you're on bioidentical hormones, we're going to say, okay, don't take them the morning of because we're just going to wash them out. But then let's take them when we get home.
Yep.
And then we really want to get more sophisticated at putting good nutrition back in.
Mm-hmm.
So the nice thing about only having one IV access is I have a free arm.
Yeah.
And so with this free arm, I can start a small IV over here, and toward the end of your procedure, I can run good nutrition back into this arm. So, and the nice thing about it is it's what we call volume identical, which means we don't reduce by washing your blood any of the volume of your blood. Okay. And the machine's really interesting that there's another option because we're separating the blood. We can actually do a different setting. So if there are some men who take testosterone that grow red blood cells like crazy. Yeah. So they literally have to go get a phlebotomy, draw off blood once every 2 weeks for some.
And why does their blood volume get so high?
Because testosterone tends to enhance the production of red blood cells in men, especially if you overdo it a little bit, and a lot of men do. This machine's really interesting is that if I do see, so drawing your blood and taking it off is pretty cheap. It still takes a big needle. It's just a hassle every 2 weeks. Well, I can actually take this machine. I can take where your blood is now. I can set it at wherever I want it to be, and it will draw off the exact amount of blood I need to reduce it.
That's cool.
Now, it's a little bit pricier than just getting a phlebotomy.
Or donating.
But if you're really struggling with it, we can really reduce it. And I had that done too.
Yeah.
So the problem is it's still pricey because we do have to put some volume, a little bit of volume back into you. And we also have to use this. This is a self-contained cassette. So there's no, once we start it, it's all your blood and there's no opening to the system. And so we also have that option for you. Yeah. So if a man's struggling and he's just tired of that, we can really reduce his blood count down to whatever we really want it to be.
That's super cool. With the IV that you would then put in them to replace their nutrition or to give them new nutrition, what do you usually put in the IV?
We'll typically have something like what you would know as a Myers cocktail with some protein and other things. So you're basically replacing all the vitamins, minerals, a little bit of protein if you choose to. That's not necessary. I like to put a little steroid in there just to perk people back up because we did pull all your steroids out in your plasma. And it also perks people up just a little. We do that in surgery all the time. We have the anesthesiologist put a little steroid in the. Yeah. Now we do it to protect nerves, but these people are going through a crisis. A surgery is a crisis situation. And in TPE, it's not really a crisis. It's much easier once you get in there than it is in your head and how you make it. But when you come in and we actually have very sophisticated machines to find veins. Yeah. So, we have an ultrasound machine that can show us exactly the vein and we can see the needle go in the vein. And so we do it in a very sophisticated manner. It's kind of almost like a spa setting, the biggest problem is if you don't have a big bladder, it can be.
Because how long does it take? On
2 to 3 hours. Depends on how much we're trying to get off and how well the blood flows.
Okay.
So the biggest thing is I can't start an IV and expect to pull off that's small and expect to pull off enough blood. And it also tends to clot if the IV's too small. Yeah. So those are the big challenges of it. We got it, and we have you eat these little calcium chews during it that taste like Tootsie Rolls. So you just sit back and eat your Tootsie Roll, and you basically just watch the machine work. And we have pretty TV and all that. That's why I say it's like a spa. It reminds me of going to the dermatologist and getting a laser treatment, but it is because when you come in, we slap on numbing medicine on your arms so that we're not poking you.
You're trying to make them as comfortable
as possible. And it's a big spa chair because spa chairs lay flat. And if your blood pressure, we have to watch your blood pressure a little bit, especially women who tend to have low blood pressure. But overall, it's actually, you're going to feel very cared for because we've got at least 2 people in there all the time, just making sure you're right, taking your vitals and doing all the things that are appropriate medically.
Yeah. So would you say it's worth it?
I would tell you for the people that it's chosen right for, it's definitely worth it.
Yeah.
Okay. The thing is, it's kind of hard to understand a little bit, and it freaks people out a little bit. Now, if you're really sick, those people know they need it. But just go to our website, look under services, and you'll be able to find and look at it. So, I mean, it is a significant effort to do, but the payoff can be very big, especially in longevity and health.
Yeah.
And I think eventually we'll be able to show that if you have concerns about Alzheimer's or there's a high risk in your family, like there's a brand new blood test out for Alzheimer's. I don't know if you're aware of that. It just got approved this week.
Wow.
And it's basically a ratio of beta tau to another marker. And we look at that marker in your blood and we can tell whether you're leaning toward Alzheimer's.
Oh, wow.
So we know that marker is in the blood. And if we actually reduce that marker, I think we're going to find that we don't tend to get Alzheimer's as much. So I think by understanding the methodology, this simple study that they did by looking at a year later and looking at standard cognitive tests basically gave us an answer that we were looking for, that it does slow it. But I think if we choose the people right, and I had Alzheimer's in my family and I could afford, I would do anything I could to keep from getting it.
Yeah.
Because it is devastating to families.
Yeah, it is.
Now, the problem is by the time most people start showing enough to get into the problem, it's a little bit too late.
Yeah. But if you can tell way early on.
Yeah, if you can start recognize that marker before you get any of the signs in your brain and you can wash that out.
Yeah. It's worth it.
I think so.
It's worth it.
At least for many people.
Yeah.
So I think it will become a mainstay in longevity, especially in neuro-longevity and autoimmune disease. I really think it's going to be a great tool.
Yeah.
It's just you still got to pay attention to the immune system and how you got there.
Yeah.
Good stuff.
It's good
Love
stuff.
it.
Well, alrighty. Thank y'all for joining us for another episode of Coffee with Dr. Stewart. Make sure you go and follow us on all of our socials and be ready for the next episode. Y'all have a wonderful day and be blessed.
This show is for entertainment purposes only. Please do not use anything mentioned in this show as your own medical advice. Please discuss all medical issues with your own provider.